Good afternoon. Today the world is severely affected by this COVID-19 pandemic, and India is also getting pretty badly affected. So we all are going to get these patients admitted to your hospital through the emergency, through your ICU, and we need to take care of these patients. To begin with, one has to protect oneself before you are able to take care of your patients. So it is important that you do donning and doffing of the personal protective equipment in the correct order in order to exercise it properly. Here is how you should be putting on the personal protective equipment, or PPE as we call it. Please note that the PPE should be worn in an area where it is safe to be without PPE. Step 1. Engage with your trainer. Step 2 is inspect the PPE before you wear it for size and damage. Before wearing the PPE, the observer has to ensure that the individual is adequately hydrated and has used the washroom. Step 3. Remove all personal items and make sure your hair is tied back if you want long hair. Step 4. Perform proper hand hygiene with alcohol-based rub. Remember all the 6 steps of hand hygiene? Okay, then step 5, sit down somewhere comfortable and wear the boot cover. The fit should be snug. Now put on the long-sleeved wrap-around gown and tie the loops. The gown should fit well and also allow unrestricted movements. Step 7. Wear the N95 respirator over the face. Cup the N95 respirator and hold it close to your face over the nose with the straps hanging low. Then hold the upper strap over the head and let it rest over the ears. Press over the bridge of the nose to create a tight seal. Breathe in and out to check for any leaks. Step 8. Now wear the hood over your head. And let it go over the shoulders and tie the straps. Step 9. Now wear the goggles that are compatible with the N95 respirator. These goggles have the side protection so that droplets don't contaminate the eyes. Ensure that no skin over the face is exposed. A visor can be worn on top. Step 10. Now wear gloves over both hands. Ensure that the gloves are pulled tightly over the sleeves of the gown. Next step is that the observer checks if the fittings are correct, is worn correctly, because these are the most important steps to proceed with the therapy to the patient. Stay safe, work safe. It is important to practice it with patience and sufficient time, not in a hurry, so that you do it the correct way. It's also important to practice the doffing in the correct order. First you do is take off the one hand's gloves, only touching the inside of the glove. Roll it into a ball and put it into the gloved other hand. Now, while touching the inside of the other glove, you take the glove off. You discard the glove in the appropriate bin. Next step is to take the glasses out. Discard it into the appropriate bin again. Third thing to come out is the gown. You can touch the straps and don't touch the exterior of the gown. While touching the interior of the gown, pull the gown out. Pull it inside out. While touching the interior, you can roll it and throw it into the correct bin again. Next to come off is the hood. Next is the shoe cover. Don't touch the exterior. First one shoe, then the other shoe. Last to come off is the mask. So hold the straps of the mask, pull it out, discard it. The last step is to practice your hand hygiene. If you practice donning and doffing the correct way, a lot of grief can be prevented and you will remain safe, your patients will remain safe. Thank you.